Okay, so as people are hopping on, again, we have an icebreaker that you can add to the chat. Awesome. Welcome, welcome, everyone. Okay, if you want to go back to our title slide real quick, Emma. So, official welcome to our Connection by Design webinar, Utah's new Social Connection Toolkit for local leaders. I'm Alicia Duquara. I am the Executive Director at Get Healthy Utah. I will be presenting with my colleagues. We have Emma Andreessen, who is our Program Coordinator at Get Healthy Utah, and Amy Black, who is our new AmeriCorps Vista volunteer at Get Healthy Utah. So we'll be switching off today as we present and are excited to share more about this topic. Again, here's the icebreaker one more time. If you want to add in your name, organization, and your favorite thing to do with family and friends, we can get to know all your fun activities and share some ideas to connect with others. I love seeing all the ideas already, and especially being outside in the summer. Once our air quality is better, of course, and enjoy the outdoors. Great. So, Get Healthy Utah, our mission, as always, is to make Utah a healthier place to live. And we partner with our state and local leaders and all of our awesome partners to do this. Our focus areas are to help increase physical activity, healthy eating, and mental well being. And the Social Connection webinar falls into that mental well being piece. We have an upcoming event, our big annual event in September. So if you do not know about this already, we encourage you to go on our website. We can throw the link in our chat, Emma just did, to register for that event. Our theme is momentum. We'll be talking about our Healthy Utah Community designation and those 3 areas that we're working on and how we can continue to increase momentum in those areas. It will be at Mill Creek Common. They have the climbing wall there and roller skating, so there's fun activities if you want to do that as well. In addition to that annual event, in August, we're going to have some Healthy Utah community listening sessions. We are in the middle of refreshing our designation program, which we do about every 3 years. And we already did a survey, and so we've been taking some of that input from the survey that some of you have taken the past couple months. We're going to come up with an outline of some proposed changes we're going to do and present on those at the August listening session. So if you're interested in seeing what we're thinking of revamping and want to provide additional input and perspectives, we encourage you to register for one of those listening sessions. Emma threw those links into the chat. And we're dividing it by cities and towns into one, our health departments in another, and then all other partners in a 3rd listening session. So we encourage you to be a part of that and give us your input. Our big initiative at Get Healthy Utah is the Healthy Utah Community designation. We have 69 cities and towns currently designated. We have our next application deadline coming up. If you are a city or town that is not on that list and would like to be designated a healthy community, we encourage you to apply. Our next application is due August 1st to be recognized at the Utah League of Cities and Towns event in October in Salt Lake. You can email us at info@gethealthyutah.org or contact Emma, and she can get you set up with a fillable application and meet with you if you have additional questions. Hey, so to our main event, while we all are here, is Social Connection. Imagine a new pill that could increase survival by as much as 50%, reduce risk for cardiovascular disease by 29%, reduce risk for stroke, reduce depression, likelihood of developing dementia, and increases your immune system response. Would you take it? This is what Social Connection can do for us. And these slides, we were able to take some from Dr. Julianne Holt-Lundstad. She is our social connection expert that lives here in Utah. We had an annual event. If you've been around with Get Healthy Utah for a while, back in 2023, our focus areas was around connection, and we had her as a keynote speaker. And then we had the opportunity to hear her again a few weeks ago at a state health department event. and get some rejuvenation around this topic area of social connection. So she shared some of these awesome stats about how much an impact and benefit social connection can have on our overall health. So you can see on this slide, not only that previous slide, but having social connection can improve self-esteem, overall better social, emotional, and physical well-being, increase our longevity. Again, it helps have stronger immunity, decreases risk for a lot of chronic conditions and health outcomes. And so this is really important to think about and see how we can work on strategies that's going to help increase social connection into our communities. We also know that loneliness is a huge epidemic right now. Ever since the COVID pandemic, we have had increased loneliness and isolation in the United States and globally. You can see on here that lacking social connection is as dangerous as smoking up to 15 cigarettes a day. This is huge for our health. And when we look at Utah, more than 1 in 3 Utahns report feeling lonely. And so this is something that is important for us to look at here in the state. We also know that there are certain groups and communities that are experiencing higher rates of loneliness and social isolation. These groups include older adults, minority groups, people living with disabilities. We also know other groups, such as our youth, are losing that in-person social connection as we're on screens more. And so we need to prioritize how we can get more social connection. Virtual is still great, but also getting back to those in-person connections and making sure that all of our community members are feeling connected and have a sense of belonging. We know that it is unreasonable to expect people to change their behavior when the social, cultural, and physical environments around them fully conspire against them. That's why here at Get Healthy Utah, we look at what we can do in our systems, our policies, our built environments and infrastructure to help support making the healthy choice the default choice and help make social connection one of the priority areas that we work on. So with that, there is a framework called Connection in All Policies. This might sound a little familiar. We did health in all policy work a few years ago at Get Healthy Utah and worked with our cities and towns on embedding a health lens into your decision making. So similar to that health in all policies approach, Connection in all policies is also looking at how you can embed a connection lens into all the things that you're doing. So how can you integrate and intentionally consider social connection with decisions, policy, programming, planning. And that question at the bottom is asking yourself, will this residential zoning, telework, transit, curriculum, workplace leave policy, anything, any decision help facilitate or hinder social connection in your community? And then you can see a screenshot. There's a lot of great toolkits and national information and frameworks that we can utilize when we talk about social connection. So this one is a screenshot from the U.S. Surgeon General's office when they really focused on social connection and continue to do so, about the 6 pillars of how you can advance social connection. So these 6 pillars again include social infrastructure, having connectional policy framework, working on digital environments, deepening our knowledge, and help build a culture of connection. So with Get Healthy Utah, we work with our cities and towns, and we know that our cities and towns have a huge impact on overall health and well-being of our residents. And this includes having an impact on social connection. We know that our cities and towns are building and planning spaces in your communities where people can gather. You're working on programming, you're doing different accessibility points to get people to come together. And so our cities continue to be a huge player when it comes to working on improving social connection. So with that, we developed a new toolkit. There's a lot of existing toolkits, but we know a lot of toolkits are hundreds of pages long. So we tried to get our toolkit down to maybe 20 pages or less and focus in on certain areas that our cities and towns could really work on to improve social connection. So we'll throw the link in the chat and we're going to kind of present on some highlights from the toolkit, but we encourage you to go in and read the toolkit. There'll be further lists of ideas and strategies, links to additional toolkits and resources. But for this webinar today, we're going to focus in on what we think are the four main areas that our cities and towns and community partners can work on to help improve social connections. So those four pieces are public gathering spaces, community events and activities, skill building programs, and virtual opportunities. So we'll spend the next few minutes talking about some of the ideas for each of these groups and then wrap up with a community grant opportunity for cities and towns to apply for to work on some of these strategies. So with that, I'll turn the time over to Emma to kick us off on our first pillar of public gathering spaces.
Great. Thank you, Alicia. So, yeah, the first kind of piece to this social connection puzzle is public gathering spaces because people need the physical space to go to in order to convene and connect. And obviously, virtual opportunities can kind of help supplement that, but it's really important to have safe, accessible public spaces. So, I wanted to start off with this quote I really like. This is from a Danish architect, and he says that a good city is like a good party. People stay longer than really necessary because they are enjoying themselves. And this is so true. If you've ever been to a place, a city, or a space that is just really beautiful or safe or comfortable, it makes you want to stay there longer than if you're running an errand or commuting rather than just going straight home. It makes you kind of linger, and that's how you meet people. And so I included this picture. This is a picture of Iowa City, Iowa. I actually went to college here, and this is a city that's very special to me because it's kind of where I first became interested in cities and the impact that they can have on health. And so we'll get into a few more local examples later on, but I wanted to highlight Iowa City because I think that it's just a really great example. They have an area called the Pedestrian Mall, and this is a space that's closed down to cars, and it's only for people. And so at this pedestrian mall, you have local businesses, restaurants, bars, coffee shops, and you also have pickleball courts and ping pong tables and playgrounds and a splash pad. And every weekend there would be people just dancing in the middle. I don't know if it was a club or what, but anyone was able to join and lots of benches. And so this was just a space where people just sat and convened, and it was really easy to connect here. And so this brings me to my question, which is, where would you all rather linger? We have two pictures here on the screen. They're both meant for people to hang out and congregate. This picture on the right here is of a coffee shop patio, and the goal here is for people to sit here and work or talk because there's tables and chairs and umbrellas, but you don't see anybody in this picture. And then you look at the picture on the left-hand side. This is of the San Antonio Riverwalk down in Texas. And here you have a space that's dedicated solely to humans. And you don't see any cars, so there's no risk of, cars driving past you quickly. It feels very safe, and I'd imagine that Texas gets pretty hot, so you have that water feature and the trees there that kind of cool off the people hanging out, and you have lights and colorful umbrellas and lots of beautiful spaces. And so I think I'd venture to guess if I were to ask you all where you'd rather spend time, you would all pick the Riverwalk. At least that would be my answer. And so it's important that the built environment provides spaces that are affordable, are enjoyable, they're convenient and safe for the essential daily activities. And so the types of activities that people engage in most outside of work, school, and daily errands are resting, playing, creating, and learning. This includes activities like sitting down, eating and cooling off, playing games and playing sports, dancing, making arts or gardening, and reading, writing, and learning a new skill. And so it's really important that the built environment provides a space for all of these to happen around each other because when different types of activities are clustered around each other, this encourages people of different backgrounds to mix and mingle more easily, and they can participate in shared activities and connect. You're able to connect to your neighbor who maybe otherwise you wouldn't have. So, I'm going to talk about a few Utah examples that some built environment spaces that do a great job of encouraging people to connect with each other. So the first one is the Nine Line Trail. This is in Salt Lake City and it's on 900 South. And so this is a multimodal urban trail. It's meant for both pedestrians and cyclists. And for those who have never used this trail, it's separate from the road. So it provides a safe space for people to be. And this entire road of 900 South, because of the active transportation opportunities around it, it's very much built for the human scale. So you have lots of local businesses. Like this big picture is of Loki Coffee. And I think that this coffee shop, the owner should teach a master class in sidewalk activation because it doesn't matter what time of year or what time of day you walk past this coffee shop. Their patio will be packed with people talking. They sometimes have events. And this is only one local business of countless on this road. Um, Aside from places where you have to pay to enter, it also connects parks like Liberty Park and this bike park that's on the top right picture. And so parks and outdoor spaces are really important for connection because there's no barrier to entry. Anyone can go. There, you don't have to pay, so it's very accessible. Often these environments are comfortable, and if there's trees and grass and water, it's cooler when it's hot outside. And so this road, this whole stretch is just a really fun place to be. And my favorite part is there's this whale statue. It's called Out of the Blue, and it kind of has a cult following. And so people will run marathons around it, which, if you're interested, that is 612 laps. People do it all the time. I live pretty close and I see them doing it, and people will ride bikes around it. And so it's just kind of a silly little goofy thing, but people connect over it, and it kind of just forces this social cohesion because everyone's bonding over their love for this whale statue. So we literally love that. Up next is the Adventure Heights All Abilities Park down in Spanish Fork, Utah. So this is a park where all children, regardless of their physical or cognitive ability, can play together. And I've never been to this park, but just reading about it is just really cool. They have so many amenities there. Just to name a few, they have a walking trail, a sensory garden, a zip line, an ADA accessible splash pad, a tree house, swings that are um, available for wheel or that are wheelchair accessible, pavilions, different types of slides for kiddos with mobility devices. And then they have other hands-on activities on top of all of that. And so this is really important because, as Alicia talked about, there are certain communities that face increased barriers to being able to connect. Oftentimes people are isolated. For whatever reason, whether that be a physical thing, a financial thing. And so Spanish Fork actually got together local families who have kids with special needs, and they talked through what is needed to be able to get kids in with disabilities into this space. And so this project is just really special to this community. And it provides a space for these kiddos to hang out with other kids where they may not be able to in other spaces. So up next is Main Street in Helper, Utah. And so this is a small rural town down in Carbon County. And the Amtrak train that goes from California to Chicago stops here. And it faces a lot of the same struggles that so many of our rural towns across the country face, with people feeling isolated or bored or feeling like they don't have a place to go. And so a few years ago, they had their first female mayor, Mayor Peterman, and she really engaged with the local community and said that, we have this beautiful historic downtown. There's a lot of potential here. What can we do? And from the community, she learned that people want this to be an artistic town. And there's lots of art galleries there. And so, as you can see, this town has really excellent placemaking. This isn't just any rural town in America. You can tell this is Helper because they have interesting signs, they have murals, they have lots of local businesses and local art galleries. And they have annual events and monthly First Friday events where they open up the art studios and galleries and they can showcase this community or this tight-knit community. It provides a space for people to come and just celebrate this town that they love. And on top of that, they also have a river restoration project, so there's access to the outdoors and people can hang out there as well. And we can't talk about the built environment without mentioning the important role that transportation plays. So I like this quote. Dr. David Grossman is an expert in social and community health. He says that ensuring transportation equity helps vulnerable populations, such as the elderly and low-income groups, to access opportunities and resources, promoting social cohesion and reducing isolation. Because if you're not able to drive or you don't have access to a car, it's really challenging to get to a place unless you have accessible, affordable, convenient public transportation. So, especially for more vulnerable communities that faced increased barriers, like older adults, some older adults may not be able to drive. And so, one 2020 study found that older adults that participate in transportation programs reported a 40% increase in their social activities. So this is really exciting. And not only does public transportation or active transportation allow you to get to a place without needing or relying on a vehicle, but it can also be its own form of social connection. So, um, whether that's having the same bus driver and saying hi to him or connecting to somebody, another passenger. A quick anecdote is about a week and a half ago, I took the bus somewhere and it was in the morning when everyone was commuting and I had just a yogurt drink I was eating for breakfast and there was somebody um, at the bus stop with me who was drinking the exact same yogurt drink as me and he made a comment and we ended up talking on the bus and um, that was the extent of our relationship, but it was fun to just meet someone who I otherwise would never have talked to. And all those types of interactions can happen when you kind of go out of your daily routine of driving or doing the same routes and gets you to meet people who maybe you otherwise wouldn't have. So I want to end this built environment section on this quote that every walking trip is an opportunity for a social interaction. So the more that you get out and about in your community and walk different routes or take public transit or try different local businesses or go to different parks, you're increasing your surface area for meeting new people and making new connections. So I really encourage you to get out and explore your local community and maybe you'll meet a friend that way. So I'm going to pass it on over to Amy and she'll be talking about the next three pieces of our social connection puzzle.
Okay, perfect. Yeah, so community events and activities. We know that shared experiences are one of the most effective ways that we can bring people together. When residents participate in activities together, they're more likely to build connections with each other and in turn feel a greater sense of belonging. And cities and towns can create these moments by organizing events and supporting recreational programs and partnering with local organizations. So this example is called The Longest Table, which started in New York City in 2022. Since then, tables have been hosted in over 30 cities across the country. So it's organized by a local host, it's open to everyone, free to attend, and it's potluck style. It allows people to meet new people, share a meal, and just remember what community feels like. From their website, I'm going to read just one quote. It says, "We live in a moment of deep disconnection. Neighbors don't know each other's names. Loneliness is at an all-time high. And the things that once brought us together, shared meals, open doors, public life, have quietly faded. The longest table began as a response to that, not with a grand program or a policy agenda, but with a table, some food, and an open invitation." Moving on into a more local example, we have Wasatch Adaptive Sports, which provides recreational opportunities for individuals with disabilities, helping participants achieve unique goals and experience physical, mental, and social benefits. So Wasatch Adaptive Sports, it serves communities across Salt Lake and Utah counties. Moving into skill building programs, which is that third pillar from our Social Connection Toolkit. Um, Part of social connection is making sure that people have the confidence and skills to build relationships and communicate effectively with other people and just participate in community life. Many residents want to feel connection, but they don't know how. And so cities and towns can help by offering programs that help people learn and just engage more comfortably with others. Skill building programs can support residents of all ages. One way that we see this is with youth city councils. Many communities across Utah have established the youth city councils. It just brings youth together, helps them learn leadership skills, advise local government, plan service projects, and organize community events. So it helps youth gain confidence, learn new skills. It gives them volunteer opportunities and experiences, and just in general, the ability to connect with others in the community. Another example of this is digital literacy programs for older adults. We see that digital literacy programs can help older adults learn skills like video calling, texting, telehealth access. So the classes teach practical technology skills. They can also help older adults maintain relationships with family and friends because they're able to access and understand how to use the technology. And then just access community resources and feel more confident engaging with the community and the world because we're becoming increasingly more of a digital world. So sometimes the barrier to social connection isn't a lack of interest, but just a lack of access or confidence. So digital literacy programs can really help remove those barriers, especially for older adults. And then finally, we have virtual opportunities. So even in connected communities, not everyone can attend in-person events or gather easily. So virtual opportunities can help allow people to connect from wherever they are. By offering accessible digital opportunities, cities and towns can help their residents stay informed, build relationships, and feel part of community life even when they can't be there in person. So it can be a useful and inclusive option for residents with transportation barriers or illnesses, mobility challenges, things like that. So one example of this is virtual library programs. So libraries across the United States, including some in Utah, provide virtual library programs. These can include access to things like virtual book clubs, craft groups, digital escape rooms, story times, and educational workshops. And they provide, again, activities for people of all ages. So for example, in Salt Lake County Library provides online reading challenges, digital escape rooms, fun STEM activities, and arts and crafts tutorials for teens, kids, and adults, which are all online. And then just a reminder, all of this can be found in the toolkit. We have even more examples in there. You can find more strategies, easy to use tools, and more local examples as well. So if you scan the QR code there, you'll be able to review the toolkit. We just went through this pretty quickly, but if you go there, you'll find more in-depth information and things that you can take away from this.
And I just wanted to add real quick, I know we talked about the individual benefits for engaging and improving social connection, but in the toolkit, we also outline the community benefits. So as we prioritize these strategies and different events and programs, all those different pieces into it, not only is it increasing individual events, but it increases your community benefits. So you'll see increases in trust and civic participation and volunteering. We've also seen increases in safety and having stronger neighborhood networks. Also supports resilience in emergencies or crises, and then just helps encourage more local pride and community engagement. And we know that sometimes we see, oh, our residents aren't engaging as much or aren't participating in civic pieces or committees and things like that. And so as we work on social connection, we can see some of those benefits in our communities.
Perfect. Well, with our remaining time, we are going to talk about a super exciting new funding opportunity that we're launching. It's titled the Social Connection Learning Collaborative and Community Grant. And we just want to give a enormous shout out to our sponsor. This couldn't have been done without the Utah Department of Health and Human Services. So we want to say a big thank you to them. And we're actually going to get to hear from a representative from DHHS. So I'm going to turn a few minutes of the time over to Anna Dillingham to have the floor.
Hi, I'm Ann Dillingham from the Utah Department of Health and Human Services, and just really pleased to be here today. I've been looking forward to this webinar. Get Healthy Utah was one of the 14 mini grants that we were awarded to work on our health priorities. So we have an initiative called the Utah Health Improvement Plan. We call it the UHIP, and it is a statewide initiative meant to be very collaborative. And a few years ago, we went through a prioritization process looking at different health issues that we wanted to tackle together as a collaborative. So state and local health department, and then any other organization interested in the health and well-being of Utahns. And during that process, the group wanted to go more upstream, so focusing on a specific health issue, look at some of these issues like social connection. And then we have another priority around access to health that looks at social drivers of health. Many of the issues that you focus on around transportation and food security. Knowing that if we tackled on the kind of these upstream factors, we can start to um, hopefully impact some of the biggest health issues that our communities face. So we have a 5-year plan where we're focused on these priorities, social connection and access to health. And maybe I'll just put in the chat our website if that's okay. So we'd love your involvement, or if you have any questions, I'm happy to share more. But thanks, Emma, for a little bit of time.
Awesome. Thank you so much, Anna. We're really grateful for the work that DHHS is doing and being able to participate in the health improvement plan. So, all right. So, a little bit about this project. This funding is meant for Utah cities, towns, and municipalities who are interested in implementing projects that strengthen social connection and reduce isolation in their communities. So we'll get more into the eligibility piece in a later slide, but if you're a member of another organization, you're also welcome to apply, but it has to be in collaboration with a city or town. So just keep that in mind. But every city and town is different and has unique needs, and their residents face different challenges. So the goal here is that these projects are targeted towards your community's unique needs. We ask that projects prioritize populations with an increased risk of social isolation. So we've talked about some of these communities, such as people with disabilities, older adults, minority groups, lower income individuals. And so kind of think about who in your community is not connecting as much as they could be. And maybe this project could be an opportunity to uplift them. Um, Projects should have the potential for sustainability beyond the funding period. So ideally, this would not be a one and done situation. And this kind of will help you with the initial startup cost, but then this could be a project that is reoccurring and a permanent thing implemented into your community. And so we ask that cities and towns to consider how their project can build towards hosting either an event or an activity on Utah Community Health Day. This is the last Saturday in April, and it's just kind of a celebration of community health and social connection. And so this upcoming year, that'll be April 24th. So the project funding and timeline, the awarded amount is going to be up to $2,500 per community. You're welcome to ask for less than that if you feel like you can accomplish a project using less funding, and maybe we can award more communities that way, but up to $2,500 per community. The application deadline is going to be August 14th. So we are giving plenty of notice because, between here and then, there's lots of fun summer things happening like the 4th of July and Pioneer Days. So I'm sure we're all busy with fun summer travels or plans. So just keep that deadline in the back of your mind. And then the project start date will be September 1st, with the project period running from September 1st through April 30th. So that Community Health Day on April 24th will be at the very tail end of the project period. For the funding uses, there are particular things that we can and can't fund with this money. So I think the main things to call out are food and gift cards, construction, permanent structures, and large equipment and furniture are not able to be funded with this money. Um, but you can use it for program materials, outreach and translation services, portable items that support community gathering, and temporary installations like a pop-up event. So just keep that in mind as you're kind of thinking through what projects you'd like to implement in your community. And then not only is this just funny funding, but we also want this to be a space for us to all learn together and collaborate. And so as a part of this grant, we ask that awarded communities will participate in a social connection assessment. So right now, our toolkit does not include an appendix, but we're still kind of finalizing a social connection evaluation tool that cities can use to kind of audit and evaluate the current state of social connection in their communities. We don't have a ton of details on this at this moment just because we're finalizing what that tool will look like. But after it's done, we will all the awarded communities will meet and kind of talk about what that tool will look like. And we ask that you complete a social connection assessment. On top of that, we'll also have learning sessions and check-in meetings. So we're not going to award you in August and then not talk to you again until April. We will check in periodically throughout the project period, and we want this again to be collaborative. So these check-in meetings, we'll probably do a couple of these, and there'll just be a space for all of the awarded communities to come together and talk about their projects, what's going well, what they could potentially be improving on, and maybe ask for supports from their fellow cohorts. And so then we'll also provide technical assistance and mentorship through our Get Healthy Utah Learning Network. So if you feel that there's a potential resource or a community partner that could help strengthen your project, you are encouraged to reach out to us and we will connect you to them or offer, guidance and support in any way. So I have Alicia and I's emails on there, and uh, we always welcome you to reach out to us throughout this project period.
And I'll just jump in there, Emma. If you are a partner that's on this call that might have a resource or a certain program that you want cities and towns to know about it, you can feel free to add that in the chat as well in your contact information as cities and towns are looking at certain projects.
Awesome. Thank you. All right, so for next steps and how to apply, our eligible applicants are Utah cities, towns, and municipalities, with the caveat that other organizations like a school or a nonprofit are also able to apply, but they have to do so in partnership with the city or town. So, as we're looking through the applications and scoring them, our priority will be given to the Healthy Utah Community Designated Cities. And so, I just want to plug that one more time that we have an upcoming deadline of August 1st for anyone out there who works for a city that is not designated and wishes to be. It's a very easy application process. So, please, I encourage you to reach out to me and I can walk you through that application and we can get that in time for the August deadline. Looks like there's a question. If you're already designated, do you need to renew? So typically, no. We do have an option to renew after 3 years of being designated. you will have to apply or to be redesignated. But we only have a couple of communities right now that were designated and then did not redesignate. So if you currently have the designation, you don't need to submit another application. Hopefully that makes sense. And thanks for that question. Um, We'll also give priority to projects that are benefiting some of these more vulnerable populations, particularly low-income populations and or individuals living with disabilities. These are communities that the Utah Department of Health and Human Services with their health improvement plan are kind of homing in on. So just think about how your project could potentially benefit those groups. And then we also are looking for projects that can demonstrate sustainability and ongoing community engagement past the funding period. So just to reiterate, some of those key dates are August 14th for the application due date, and then the project start date will be September 1st. So pretty quick turnaround time, but very much doable. So the application is right here. We have a QR code, and then I believe we will put the link in the chat. Yeah, Alicia put the link in the chat already. Thanks for that. So when you scan this, it'll take you to a page that asks you to make a copy of the application, just so we ensure that nobody's, working on a document that others can see or, mess with at all. So it'll make you do your own copy, and then once you fill that out, you can email it to us at info@gethealthyutah.org. And we'll send out these slides so that if you need to refer back to these, you're able to. So to kind of wrap up our discussion on this community grant, we have a couple of ideas for some example projects. So one potential is a potential project is a community club, such as a craft night that has accessible meeting locations, and you can spend the money on translated materials and program materials. Mobile neighborhood connection events are also a great idea where you can bring an event such as a storytelling circle or a conversation event to a neighborhood. So those with transportation barriers, you kind of mitigate that barrier a little bit by bringing an event to them. And then lastly, you could do an intergenerational digital connection program where youth teach older adults how to use technology like smartphones, video calling, or virtual programs. So those are a couple of examples. Again, as you're kind of thinking through what you would like to do in your community, just make sure that you're referring back to the funding, what the funding can be used for. So with that, that kind of wraps up our webinar. So we have an evaluation survey that we'd really appreciate if you all could fill that out. So I will put the link to that in the chat. And so it's only a couple of questions, so it'll take you probably a minute to fill that out. But with the remaining about 15 minutes, we're going to open up the floor to any questions that you have about anything we talked about today, the toolkit, social connection in general, or the community grant. So I want to thank you all so much for coming to our webinar, and we will be happy to answer any questions that you have. And feel free to unmute yourself and talk, or we'll be monitoring the chat if you want to drop a question in there.
In the grant guidelines, it says that funding cannot be used for large furniture, large equipment and furniture. How large is large? What does that exactly mean?
Yeah, so that would be probably, I don't know, Alicia, if you want to jump in and correct me, but in my mind, that's kind of things like big playground equipment, big furniture or big like benches, things like that that are permanent. So,
So it can be more for equipment for like programs, so more like program material type pieces. This funding is coming through the State Department of Health, and so they have different restrictions. And if you have specific strategies or ideas that you're considering, we can always ask the Department of Health if that counts or not with their restrictions. So if you have specific things you're thinking, feel free to email us and we can get further guidance. But yeah, it's more kind of supporting smaller type of program equipment or supplies versus that.
Okay.
We talked a lot about the built environment, which we'd love this funding to go towards building the built environment and benches and fixing up Main Street or things like that. But there is that restriction with this funding specifically on that.
Okay, so maybe a general rule of thumb is like portable. It has to
Yes.
be. Okay.
Portable. Yep. Exactly. Yeah. So portable items that you can use. And I think that's on the last bullet point. So if there are like temporary type pieces or portable things that you can bring in, when we're thinking about the built environment, when we're closing down streets or trying to do some community gathering, potentially some of those portable items. Again, we'll be running past the different applications by our state health department partners that have the different funding restrictions as well. But if you have questions ahead of time before you submit, feel free to send them our way and we can make sure to get a green light or red light depending on what you're looking at. Any other questions?
First of all, Alicia and Emmett, let me just mute here. Great presentation. Nice to see you again. Howard with Real Day. Two quick questions. One is, if the program works, we meet with multiple, Alicia, as you know, multiple mayors and cities.
Yeah.
If 2 or 3 of those want to do some Real Day kind of activities, can there be multiple participation for a similar program, the same program?
Definitely.
Look at pick one city and that's your only funding application.
No, I think if we have, yeah, if there's a program like Real Day that's wanting to work with multiple jurisdictions, or we just ask like a letter of commitment or, a letter of partnership with the cities. And so if you're wanting to reach out and include a few cities, just including kind of that letter from each of those cities and saying that you're going to work on doing that program in multiple communities. So we definitely, yeah, you can do more than one community as long as you kind of show that those communities are interested and willing to engage in it.
So the application would come from Real Day, not an individual city. But Real Day would indicate that it's in partnership with that city.
It can go either way. You can either have the city submit and say that they're going to work with Real Day, or you, as Real Day, could submit but have letters of commitment from the cities that said that they're going to work on it with you. So it could go either way.
And then the second question is, I noticed it looks like priority is given to underserved populations. What we do is fairly universal. It embraces all those populations. Should I try to be more specific if I choose to apply?
Yeah, we still encourage all different strategies that impact the general public and general residents. So there are certain programs that might be more specific to these populations, and there might be other strategies that's going to benefit the general community. But then we ask if you want to kind of have higher points on your application, if there's some additional pieces you want to add on to your program or some specific outreach that you're going to do with certain groups. It can still be, yeah, we're going to do this general program for the general public and the city. But we're also going to maybe do a couple outreach or these different potential pieces to help make sure we're engaging these other populations. So it could just be adding a little bit to some outreach activities or making sure accessibility is included with some of your efforts. But the strategy could still be overall for the public, for the community.
Cool. Thank you.
Yeah. questions or comments? Okay. Well, if you do think of any questions as you're digging into that application, feel free, you can email us and we're happy to follow up on those specific questions. As Emma said, we'll be sending a recording and the slides and information out in an email to all those that are registered for this as well, and we'll upload it to our website and we'll send that out. So thank you for being a part of this today. We're excited to work on social connection efforts and to have this funding to be able to start some awesome programs across Utah. Thank you.